Hello, welcome back. It's a beautiful day and we really thank God for that. So today guys, let's gather here to acquire some knowledge under health issues regarding ectopic pregnancy. We all understand that when you get to hear that someone is pregnant, obviously in your mind you get to understand that the baby is in the womb or in the uterus. Yeah. However, when you hear of ectopic pregnancy, it's not in the womb. It is outside the womb or outside the uterus. So in matters ectopic pregnancy, this is whereby the fertilized egg fails to implant itself in the uterus. Rather, it implants itself either in the fallopian tube or somewhere else. But mainly for today, let us just get to understand how it works in the fallopian tube. Here, when the fertilization in the fallopian tube, the fertilized egg is supposed to move and get itself implanted in the uterus. But sometimes if it fails and remains in the fallopian tube, this is called ectopic pregnancy. Yes, it normally fails. The pregnancy does not survive. The baby can never stay there. From the medics explains, an ectopic pregnancy can stay not more than 3 months. If you stay more than 3 months, it's very life-threatening and someone can lose their life, and that is now the lady, the woman or the mother. She can lose her life because the space in the fallopian tube does not expand to allow the baby to grow. It is so tiny, it is just small to allow the movement of the egg during ovulation and in these other processes like now pregnancy. It can never happen. So what are the causes? Because I know most of the people don't understand that ectopic pregnancy is there. But if you visit these health facilities, you will never fail to get 1 or 2 patients who are victims of ectopic pregnancy. And this is a serious issue that most of the people never get to understand until they are caught in the mix. What are the real causes of ectopic pregnancy? One of them is infection. Yes. Serious STDs, sexual transmitted infections. If you get to have sex and in the process you get infected and you get pregnant, at highly you might get an ectopic pregnancy because of the whole flow of the all flow of the female egg and the sperms to meet. There is just a smooth process there, the lining, the smooth lining and everything, which is mostly affected by the infection. Because you understand, sometimes it's not easy with these serious STIs. Some of them are so serious, they might just slow down the movement and the fertilization happens during all that process. So infections can cause ectopic pregnancy. And on the list number 2, we have a woman born with an irregular shaped fallopian tube. We all know now that fertilization happens in the fallopian tube. And after fertilization, the fertilized egg is supposed to move smoothly to the uterus. But if the fallopian tube have an irregular shape, it might cause, it might make the movement of the fertilized egg to have some rough movements, causing it to be implanted there, causing ectopic pregnancy. And number 3, we have some family planning methods. Some family planning methods. These birth control methods one of them being IUD. IUD happens, it's this method whereby a foreign object, it's just a small foreign object is inserted in the uterus to prevent pregnancy or pregnancy to happen. When this, most of the people will tell you who have gone for the IUD, they'll tell you that there is this or caution they are given by, a warning they are given by the doctors, that if you get this kind of a childbirth control, you are supposed to maintain one partner, no mixing. And I don't know if they have ever asked why is it one partner only? You're not supposed to mix. This is one of the reasons. If you mix partners, chances are that the IUD might either fall off or slip and go in the wrong position. It is I don't know how they position it. Medics understand how it is supposed to be positioned in the uterus, not anywhere, not in the cervix, not anywhere else, but in the uterus. But if you mix partners, the IUD might fall off or slip and go in the wrong position. So if it falls, better for you, you will have that in mind that it has fallen off, so it is risky. Anytime I might get pregnant. But if it goes in the wrong position, it might cause this ectopic pregnancy. Yes, just go and check how it causes, but that is one of the cause. Then under the same childbirth control, we have use of these pills. Yes, and under the pills, I know we have different pills. We have pills, daily pills, the one you use daily, but we have these emergency pills. Emergency pills, whenever you go or whenever you read on that leaflet, there is always a warning, or even the doctors, even the pharmacists who sell them there is also always a warning that don't overuse it. At least twice or thrice per year. Don't overuse e-pills. You've never asked why. Why is it? Why are they saying that we should not overuse it? E-pills are a major cause of ectopic pregnancy. These pills, first of all, they cause we have different of them that have different hormones. E-pills are different with the different hormones. We have one of how they prevent pregnancy to happen. We have one of them, they slow the movement of the male, the sperms, they slow their movement. That's why they give you up to 72 hours, you're supposed to have taken the pill. So they slow the movement. By the time the male sperms are reaching the female egg, it might have died. So nothing will happen, you won't get pregnant. Also, it prevents by, the lining, the uterus lining, the uterine lining. It is made in a state that it will give that fertilized egg an opportunity to implant on the lining. But when you take these pills, they make I don't know how they just work in a sense that the lining is not able to hold the egg. So for some unaweza pata sasa the egg is fertilized, but the uterine lining is not allowing it to implant. The egg is okay, it is fertilized, lakini implantation in the uterus haita happen. So that is how the e-pill works. And e-pills, they have that strong, they work in a stronger way compared to the other pills. because you understand we have different pills, but now hii pill inafanya kazi in that iko so strong, it is so strong compared to these other pills. So that is why they are warning the ladies, don't overuse it. At least twice or thrice in a year, it is okay. Don't overuse it, because it is an emergency pill. It's not something to be used now and then. It is just for emergency, and that is okay. So if you continue using it, or if you use it, you can imagine that this is just an imagination of these pills. You've used it mpaka, you know, umeitumia to an extent that slow ovulation. Unaona, slow ovulation, and then at a time inakataa kufanya kazi. Yes, it fails to work. And when it fails to work, because you've used it to an extent that it can't work anymore, the hormones produced are just there. So now ovulation has happened, fertilization has happened, the egg is just there, it is not moving. Implantation will happen in the fallopian tube, causing ectopic pregnancy. So how can you tell that how can one tell that you can get an ectopic pregnancy? Like, you're just there and you're like, I might be affected. How can you tell that you might be affected? When you have recurring STIs. When you have recurring STIs, you can get ectopic pregnancy. Yes, so you should get checked up if you want to get a child. If you want to get a kid, you should get gynaes to help you go through the process and get a safe pregnancy. Then if you have an IUD at the time you are getting pregnant, if you have this IUD as your childbirth control, then you are pregnant at the same time, get checked, because it might be ectopic. It is not, but it might be ectopic. If you've had an ectopic pregnancy before, people who have had ectopic pregnancy before are at a very high risk. Even if you go to medics, you go to a gyna and get that counseling all through, they always tell you that before you plan to get another pregnancy, please be and keep in touch. Then if you have a history of infertility, yes, people who have a history of infertility and are trying to treat the infertility so that they can be able to get a child, they are also at a very high risk. Yes. Signs of an ectopic pregnancy. So guys, ectopic pregnancy, iki happen in the first stages, it is always a normal pregnancy. And people who are living in the third world countries, we believe in, everything is just okay. Everything is not okay until you prove that it is okay. However, how much we believe in, a baby is a blessing, everything will flow okay, let us not take it that way. If you are in a position to do that, whenever you just feel like you are conceived, it is better for you to go for checkup, go and get that ultrasound to be on the safe side, because the signs of the earlier signs of an ectopic pregnancy, they are just normal signs. Ni normal too, because one, you will miss your periods. Yes, normal. You will feel nausea, vomiting, dizziness, which is okay for some people. It is just normal. However, now this is where it gets to a point when the more it grows, things change. And as things change, still, this is still normal for some women who have ever conceived, it is still normal. They feel dizzy, there is that spotting. It is still normal for some people. However, if you see these signs, please visit a medical facility and get checked up, get correct answers of what is happening. If you have too much severe tummy pain, you feeling dizzy, you have light vaginal bleeding or spotting, go for checkup. And if you have discomfort when going to the toilet, now this is one of the symptoms that I would like to share with you people. This discomfort when going to the toilet, it is just the normal feeling when someone is giving birth, normal giving birth. You feeling like something heavy. Yeah, you feeling that heavy, you see, in your abdomen. You feeling like something is heavy and you are, you going the toilet but it's too heavy, you have some too much abdominal pain, and it's like something is going, it's coming out of your body from below, something is coming out. Go for checkup because it is not okay. So if you want to do this, if you want to go for checkup, the fertilized egg will continue growing in the fallopian tube, and it cannot grow to some other extent, because if it grows to a larger extent, it will cause the fallopian tube to rupture, and if it ruptures, there will be bleeding from inside. Bleeding from inside, it is life-threatening, because blood bleeding from causing clotting inside, it is not safe. So during this experience, the final stage, because you cannot go beyond this, it's either you go for treatment or you lose your life. So during this period, it is the blood coming out, you are now fainting. Yes, kuna fainting. Now this is the extreme symptoms. Una faint, blood, now blood is flowing, and so it is now the last stage before you seek for medical attention. So how can you prevent ectopic pregnancy? We've learned about the causes, one of them being infections, and some of the childbirth control that someone chooses to use. So guys, one of them is using a condom. Condomize. Huku nje sio kuzuri. However, how much people may say that, yeah, we feel good without and all that, please condomize. Use condom. And if you can't, maintain one partner. Have limited sexual partners, because the more you do that, you'll get STIs. Sometimes we have recurring STIs. However, how much you may treat them, it will still happen, it will still recur. So condomize or have a limited sexual partners. Number 2, check the type of childbirth control you're using, because things like e-pills, they're not supposed to be used more often. They are not. Yes. And how is it diagnosed? How do you find out that, you are having an ectopic pregnancy? Go for urine or blood test. Yes, that pregnancy test. Go for urine and blood test. How is it determined? We understand that when an egg is fertilized and everything is changing, we have change in hormones. I don't know how they are called, I am not a medic, but if you go to any health facility and get a clear checkup of what kind. We have this HCG. Yes, the HCG level inaongea, it is talking. If you have a normal pregnancy, the HCG level is higher. Yes, if you have a normal pregnancy, the HCG level is higher. But if you have this ectopic pregnancy, the HCG level is lower. So go for that checkup. And another checkup is the ultrasound. Go for ultrasound. First of all, you found out that you are pregnant. So go for that ultrasound checkup and let them tell you that yes, you are pregnant and this is where the fertilized egg is implanted. Let them not tell you that you are not pregnant. I was in another hospital and the lady was being told that she's not pregnant, but she had conceived, but she was told that you have not conceived. So get a clear checkup, go for an ultrasound, and let them tell you where is the egg implanted. That is the question. Where is it implanted? You will get your answer. So how the treatment now? When something has happened, it has happened. What we need is the treatment, and especially the earlier treatment. Guys, when you go for all these checkups and they determine that you have an ectopic pregnancy, as the earlier you get the answers, the better. Because when you get an earlier answer, they will give you some drugs which are called methotrexate. Methotrexate. These are drugs given to someone who has an ectopic pregnancy at an early stage. What is an early stage? An early stage is whereby the egg is still so little and the fallopian tube is still well. It is not ruptured. It is still in position. It is still in good condition. So you'll be given these drugs. You will take them, and then the blood or the egg, which is still blood, will flow out just like the normal period. We have the disadvantages, a lot of things that will happen after that, but you will have saved a lot. However, if it stays longer, the fallopian tube will rupture, causing bleeding within you, and that bleeding, it is life-threatening because you will have blood clotting and all that. When you go for now the treatment during that stage, a lady undergoes, or a woman undergoes surgery, which is might be laparoscopically or laparotomy. Laparoscopically or laparotomy, whereby the surgeons or those taking control will have access to your internal, to that place, and get rid of the blood. Yes, they'll get rid of the blood, and because the fallopian tube is ruptured, they'll have to get rid of it. Yes, so that's what we've learned today. Get some knowledge, guys. Huku nje, usingoje paka dakika ya mwisho umekuwa victim. That is when you are learning it. You might have a friend, you might have someone. Get them to learn this. Get them to get some knowledge about ectopic pregnancy. It is so bad. Just a 3 or a 2 weeks pregnancy, rupturing, and the fallopian tube undergoing rupture, bleeding within you, clotting. Some people might die, and some might end up, losing the fallopian tube, which will help you get a baby. It is gone, all that, and causing just a lot of damage and any other. Thank you.